our project, which is part of a professional diploma of hospital management, the 18th batch, under supervision of Dr. Mohammad Elsheikh. He is CEO of Bash Hakim and professional certified training consultant, healthcare quality consultant at HM, also under supervision of Initiative Management Consultancy. Bismillah ar-Rahman ar-Rahim at the beginning, and I want to present my colleagues. First, we'll start Mr. Majd Alkateb. He will start the presentation, then me, Dr. Khaled Alkateb, and then Mrs. Islam, then Mrs. Manar, then Mrs. Raqia.
You are most welcome. Excellent team.
Thank you very much. Now, Mr. Majd will start the show.
Hello, Dr. Mohammed. Hello, everybody.
You are most welcome, Mr. Majd. Go on.
Yeah. Our project definition, Alkateb Dental Center is providing only the free and a serious environment. Providing the following dental services: orthodontics for adults and children, prosthodontics, dental surgeries and implants, conservative dentistry, including dental filling and endodontic treatment, and pediatric dentistry.
Excellent.
Our vision to be the best dental center in the Al Ain city and surrounding areas. Mission to be best dental services and customer services in luxurious and infection-free environment. Our goals, short-term we have short-term goals, mid-term goals, and long-term goals.
Kindly, Mr. Majd, I want you to choose only one goal and then tell me its objectives. Then tell me tactics of only one objective.
This is what we will do, Doctor. It's my part. After this slide, I will start directly to do this thing.
Okay. Okay. We don't want to read it in read them in details. I saw them. Goals are very clear. I only want to know what's after this. I need choose one goal.
So I will take the lead from here. So as you saw, Doctor, short-term and mid-term and long-term goals. Short-term, it will be at the beginning from the establishment till the end of the first year. Mid-term, it will be from the end of the the first year till the end of the second year, and the long-term till the end of the fourth year. Okay. So
excellent.
For the objectives, also again, we will make it smart, specific, measurable, achievable, and relevant and time-bonded. We will choose one objective, which is the establishment of Alkateb Dental Center. It must be done within 7 months, this objective. And we will divide this objective to short-term and mid-term and long-term objective. Each of them bonded with a time also. So there is a lot of details, so I don't want to waste the time on this.
Excellent. Let's go ahead for tactics of one objective.
Yeah, so I choose for the tactics, we will do tactics for the following objective, which is the buy and install interior furniture of the reception, dental rooms, offices within 2 months after DOH initial approval. It's also smart. It must be smart, of course, and containing all the details that you saw it, Doctor.
Excellent.
Okay, we can go on.
Okay. Go ahead.
So, according to what we learned in our course, we need to study the environment of our business. Okay, so strategically, we have 3 levels. We have the internal level, which is internal environment of the work. Then after that, surrounded by micro, then macro environment. At the beginning, we'll talk about macro environment analysis. We use for it a PESTEL.
Kindly, Dr. Khaled, I want you to ask you about in your PESTEL and your Porter and the SWOT analysis. I want to ask specific questions. From your point of view, according to your PESTEL analysis, what is the most important strength point from your PESTEL, and what is the weakest point from your PESTEL for your project?
Uh-huh. So for me, in my opinion, okay, and from my study for my project, okay, the strongest thing in the PESTEL is the economical. Economical is very
Excellent.
strong. Yeah, it's a promising project, and the economy of UAE is very good and strong and stable economy, especially in Abu Dhabi Emirates. So we can depend on that. But
Right.
also, the weakest point is the legal area because we have a lot of complicated processes. So a lot of things, it's not mentioned here specifically, but
No
now I'm
problem, no
giving you,
problem. The
yeah,
most
I'm giving you
important
my
for
point.
me in the discussion that exactly what you said, that you are aware strategically about your pistol value. What is the most strong point and what is the weakest point?
Yeah,
Excellent.
mainly
Kindly
this is
let's go to the porter. And my question in your porter analysis is,
Mhm.
according to your understanding for porter analysis, what is the
Mhm.
most important force that make more pressure against you, and what is the weakest force against you?
Against me, both of them against me, or something support me and against me.
As you know, about Porter, they are five competitive forces against you. Okay,
Yeah, yeah.
I am asking you
Okay,
now,
yeah, yeah. I get your point. I
which
get
of
your point.
them is
Yeah.
the most force making more pressure on you, and which is the least
The weakest one.
pressure force?
Let's start with the weakest one, the bragging power of suppliers, because the
Yes,
UAE market, as we said before, economically is very strong. So this is lead to a lot of companies, suppliers, to open their startup and to open their projects here in UAE. And there is a lot of
excellent,
companies. So this will saturate the dental market with the dental material market. Okay,
excellent.
this
So
will
you
lead to
don't have any
decrease the power. Yeah.
excellent. So you don't have any monopoly or oligopoly in
No.
the
Yeah.
market of supplements. Excellent.
Yeah. On the
What is the
opposite
most?
side, on
Yes,
the opposite side, we have saturation also in the market, but with the dental centers. A lot
yes,
of dental centers already established since long time, and some of them they are working at the same category of our category, the luxurious one. So we have a lot of competitors. So the degree of rivalry will be little bit strong, and also this will affect on the bragging power of buyers
excellent,
because
Dr. Khaled.
there is a
Great
lot of
understanding.
yeah.
Yes. What about your SWOT? From your point of view, what is the most important strength point for you? What is the weakest point? What is the most brilliant opportunity upcoming to you? And what is your most threatening threat? Choose one for each, please.
After we make a brainstorming between us in the team, we conclude that the strength, the best or the strongest point in our work is the experience. Most of
Excellent.
our workers here, they have a good experience in the dental field in Al Ain city. So
Yes.
this will facilitate our work, and this will give us a large push at the beginning of the work. We have already patience.
Excellent.
The weakest point, in my opinion, is the threats. We have a lot of threats, especially in the nowadays. Maybe we have a risk of financial crisis and the stoppage of government support for insurance. Also, maybe we have lockdown because of the COVID-19. Till now, it's not solved. We don't know it will be solved later, or we will have another viruses. So we have a lot of threats in the environment.
Okay.
So in my point, my strategic point, this is really a threat.
Excellent.
Okay, we can now move for the professional planning for healthcare organization, the strategic planning model. So
Excellent.
according to your request, doctor, we choose one model for the planning, which is the BMSP model, which is
Yes.
performance measured strategic planning. We depend
Yes.
on our competitors to build our plans.
Yes.
So we need to study the market very well at the beginning, as we said, and we need to do scouting and perform studies on our similar competitors to see what are their advantages and promotions and how they attract their competitors. So we will give here as example, if you want me to go ahead with this example, or we can
Exactly.
go to...
Exactly.
Okay.
I want to know specific example of what one of your competitors make, and what is your performance measured strategic planning to overcome this
Yeah.
competitive edge of your competitor.
As it's clear here in this slide, the competitors mainly we will have a problem with the price. As in this example, the orthodontic treatment full price for with other competitors is 6,000, while the average price in our clinic we put it 10,000. So there is a lot a big gap between us. So what we need to focus in our marketing campaigns on the long experience of our orthodontists. And we need to show them that experience is very important to gain good results, and nothing, and that's always the good results or the good deals will be the price only. Also, we need to make offers for orthodontic treatment, like gain three free full cleaning sessions during your treatment, one free teeth whitening session at the end of treatment. All of these bonuses we can also add it. Also, we need to restudy our prices and our customer categories. So to check if we can make specific discount for a specific category of our customers.
Excellent. And you can emphasize the difference between your high quality materials for orthodontics and the difference against your competitors for the quality of their material in orthodontics.
Yeah,
the quality of material is also have a weight in the pricing. Excellent. Next.
Of course. Now, next, I think now it's the turn of Madame Raqiya Al-Kurdi to continue, please, from here.
Okay, thank you, Dr. Khaled. Welcome, Mr. Raik. Go on.
السلام عليكم دكتور محمد.
Sorry, Madame Raqiya. Raika. Sorry, I'm very sorry.
Yes.
It's okay. It's okay. We will start with the operational planning for the executive of macro operations. It has 6 steps in it. We will start with the system, which is the establishing of the Alkateb Dental Center. Then in the macro, we will be choosing, there are so many, as it was mentioned by Dr. Khaled, it has choosing the location, the building setup, the furniture, the hiring, the marketing points in it. And then if you will go more in details under the processes itself, that we will be choosing the dental chairs, the autoclaving machines, the furnitures, which including electronics, ACs, computers, water dispensers. More, if we will go for the sub-processor, there is interior, for the furniture, there is interior design in it, needed to be taking quotations for equipments and furnitures, education, brokers, and choosing and the HR also team has a lot of work to be done under the sub-processes. There are also activities, which is agreeing on the prices provided for the patient services, agreeing on the ways of treatment, payment system, referral from hospitals, from other competitive centers, and evaluation of our services, education to the patients. After that,
excellent, Mr. I only have one comment that I prefer to make operational planning in mind mapping manner, as we discussed it in our diploma, that to make mind map of fragmentation of each process under under each one, not all micro processes, then all macro processes and so on. No, it's better to make the sub processes of each process under it in mind map 3 diagram. Okay, and then activities of each sub
processes to be under
as we teach. I know this is great effort, but we are trying to make more improvements. Thank you. Next slide, please.
Next slide, دكتور خالد لو سمحت. Here is the executive action plan for some tasks. We took who and what, when, where, why, and
excellent. Very
how.
clear. Very clear.
Yeah.
Next
slide, Dr. Khaled. We have 6 steps in the quality steps.
Yes.
The first step is establishing Alkateb Dental Center, as it was explained by Dr. Khaled, how we have the strategic planning and in my previous slide. Step number 2 is
major external customers from your point of view.
The major customers are the adult or children with dental problems.
Yes. Which is more than the other, adult or children?
I think children nowadays.
Okay, next slide, please.
Now Mrs. Islam will start, inshallah.
Okay, thank you, Ms. Raida. Welcome, Ms. Islam. مساء النور.
مساء الخير. Now step 3, discover the customer need by survey and focus group. وهون في كان نموذج لمثل تقييم نعطيه للكاستمر عندنا. Then encouraging to vital view. We will do loyalty program and continuous follow-up and no waiting time for them, and buying the best materials for them.
Yes, from your point of view, Ms. Islam, after you make discovering of your customers' needs, from your point of view after prioritization, what is the most important frequently needed from your customers? If you want to choose specific vital few needs of your vital few customers, which need did you discover it's the mostly needed?
قصدك انه كيف بدي اكتشف شو هم بدهم؟
لا، لما انتم عملتوا سالتوا العملاء عن احتياجاتهم، حضرتك اكتشفتي ان ايه اكتر حاجه طلعوا محتاجينها؟
هلا بدي اقول في اللي هو ستيب 4 انه احنا هم كان بدهم اكثر من شيء. كان في عندنا شويه مشاكل بالويتنج. تمام. عند بالسيرفيس اللي بنقدمها لهم، لهيك احنا هلا انا بستيب 4 we develop product by using CAD CAM in producing ceramic units.
Yes. وكان سؤالي عن هل يا ترى لما انتوا عملتوا احتياجات العملاء لقيتوا ان ايه اكتر حاجه محتاجينها العملاء، فعلى اساس كده قلتوا ان السيرفيس اللي هتقدموها هي الكام كاد او كده، يعني لقيت ان
الويتنج مشكله التايم، مشكله التايم.
لما ده هيقلل بقى الجهاز ده هيقلل الويتنج تايم،
بيقلل بيقلل هلا التايم. يعني هم بالاساس انه بيكون بدهم وقت لما يعملوا عندنا الفحص ونبعث النتائج لللاب، ولما توصلنا الشيء اللي احنا طلبناه منهم فبياخذ وقت. لهيك احنا قررنا انه نستخدم الكاد كام بالقلب بالدنتال عندنا.
Excellent. Next slide. Next.
لما عملنا
Okay, CAD-CAM is a very good service satisfying the vital few customer needs of the vital few customers. Excellent. Tell me how you will develop it.
التاسك اللي هو طبعا الدنتست اللي راح يستخدموها when after 3 months inside the dental center, how we use it, camera work.
Okay, no problem. Here we want to make simple modification in step 5 here. We want to make operational executive planning of how exactly in steps we will provide CAM-CAD. Okay, number 1, if CAM-CAD is a system, what will be the macro processes? Then under each macro processes, what is the processes and sub-processes till reach the task. Okay.
دكتور اسعفني شوي يعني شوي توضح لي بالعربي.
نو بروبلم. ان احنا بس محتاجين نعدل شويه بس في السلايد دي، ان احنا نفصل شويه نقطه ان انا يكون واضح لي يا ترى انتوا هتطبقوا الكاد كام ده ازاي، هتعملوه ازاي. لما لو هنسمي الكاد كام ده هو السيستم، فايه بقى العمليات الكبيره ثم العمليات الصغيره اللي انتوا هتعملوها عشان تقدروا تطبقوه في المركز. فالتفاصيل دي بس محتاجين ان احنا نكون كاتبينها في ستيب 5 هنا. فهمت قصدي؟
يعني قصدك انه غير التاسك كان المفروض اني اوضح
قبلها.
للكاد كام؟
قبل التاسك. ايوه ممتاز.
خلاص نوتد دكتور، ان شاء الله
اوكي ثانكس. نيكست سلايد.
الكي بي ايز لحتى نضمن الكواليتي للكاد كام. فورت كواليتي اوف سيرفيس حطينا لعندها 40.
Okay, it's clear. You can skip it and go to the next slide. Clear KPIs. Excellent.
Now we will give the lead to Mrs. Manar Taha.
Okay, thanks, Miss Islam. Welcome, Miss Manar.
السلام عليكم.
وعليكم السلام. How are you, Miss
صوتي
Manar?
واضح؟
Yes.
Yeah, so clear.
Go ahead.
Okay. أول شيء بالنسبة حق my part, I started with key bonus indicator. I have chosen 2 positions in our clinic, which is the public relation officer and reception manager.
Let's go with public relation officer. I want, as I told you before, when you are making KPIs, to make it with percentage. We want all KPIs to be the summation of all KPIs equal 100%. So my question for you is, what is the percentage for each KPIs of this to make the summation 100%?
Actually, yeah, I understood, but actually I looked at it in a perspective of differentiating between efficacy, efficiency, and effectiveness.
Okay, how do you will you make evaluation of efficiency and effectiveness of public relation officer from your point of view?
Okay, for a public relation officer, for efficacy, is that the public relation officer should actually provide social media engagement. If the public relation officer is providing social media engagement, that will make him efficient. So that means he is able to make engagement in social media, but that is not necessarily guarantee that this engagement is positive, or if he is engaging with our targeted audience, because as you know, social media platform is public. So for this, for this point, I have chosen efficacy. For effectiveness, that the public relation officer is actually conducting events. Why is he effective? Because he has chosen an attendees of influencer and journalists, which can actually participate in spreading and marketing perspective. If we have influencers and people who are widely known in our community, they will provide, of course, an advertising edge to this event. So this will make him effective.
I can interfere, Doctor, 1 second.
Yes.
Yeah, Dr. Mohammed is referring to the 10 points, I think, that he mentioned to us regarding the evaluation, like the time and attendance, communication with peers, communication with managers. I think this that will make the 100% as KPIs. I think this is what you mean, Doctor, right? Hello, سامعني دكتور?
Yes, exactly. And we want to not to forget important notice for KPIs of HR department and the quality department and other medical departments. So when we are making KPIs for any position, we should put in mind what HR departments need, what quality departments need, what about patient safety and infection.
So the council, what we said, like make a council and they will conclude.
يا جماعة عندي مشكلة بالصوت، ما أدري من عند الدكتور ولا من عندي.
No problem. Yes, it's clear now.
We can go ahead, Doctor?
Yes, go ahead.
Mrs. Manar, you are hearing us or see
Hello.
the? Yeah,
Yes,
we are.
go
We
ahead,
are
Dr.
hearing you.
Manar.
We are hearing you.
Go ahead. You can continue, Miss Manar.
I don't know if she's
Hello.
hearing. Yeah, we are hearing you.
Yes, continue, Miss Manar. Do you have a problem, Miss Manar? Okay, if she has a transient problem, Dr. Khaled, you can proceed to save our time.
Okay, so she now in this area, she is talking about the job announcement.
Yes,
Okay, she is making the job announcement and she's talking about the job code, description, responsibilities, requirements, special
excellent.
specifications,
Excellent
package.
job announcement.
Yeah,
Thank you very much for this
as you
job.
informed us. Yeah. Now,
Excellent, excellent.
now she is talking about the balance scorecard.
Yes, my
Uh,
question
uh,
in balance scorecard is, as I told you when I was discussing it, from your point of view strategically, what is your strongest card and what is your weakest card?
of course, yeah. So our strongest card is the internal business process. Okay,
Excellent,
Inter internally we are very strong. The
excellent.
weakest point, in my opinion, it will be in yani we have a lot of weak point, but I think the weakest point it will be the customers itself, satisfying the customers and finding, let's say, a new market inside a very small market here in Al Ain. It will be a little bit difficult. Also, financially, the budget is not large, so we are looking to be luxurious. Also, this will be a little bit complicated for us at the beginning. Maybe we need
Excellent. But
find a new funding.
in the problems of customers, marketing can make the
Can solve
solution.
the
And
internal
for
process, the internal
financial,
business.
yes, and for financial investors can make the solution. But you
Yes,
have the most important card strong, which is internal business process. So this is very promising that in your center, your internal
Hello.
work environment is best, and this is very good.
Hello,
yeah,
Uh,
doctor. Can you hear me?
yeah. We are
yes, I can
سامعينك.
hear you now.
Oh my
Next
God.
slide, please. After balance scorecard. Next.
تفضلي
So
منار
you.
سامع. Yeah.
Okay. So we have. I think Dr. Khaled moved on with the other parts, right?
Yes.
Okay. Sorry, I had an internet issue.
No
No problem
problem.
at all. No problem at all. My question for you, Miss Manar, is what is the change that you will apply Kotter model for? What is the change?
Okay, for Kotter model, I have provided here like a case study, a situation. Let's assume that all employees in our clinic has received a memorandum. This memorandum I have written in details, which will describe the change and also will mention why this change is needed, what's the urgency of this change, and what it will be. So the change will be applying a new strategy to evaluate staff and to create a better patient experience. This is mystery patients. For those who don't know, mystery patients are patients who are actually working in cooperation with us to evaluate the service, but they are working in disguise, which means that the doctors or nurses or any of our staff don't know who they are. They will act as if they are normal patients. Can you hear me? Sorry.
Yeah, we
Yes.
are hearing you.
Okay.
Yes, we are hearing you.
We have announced here a memorandum that we are working with these mystery patients to actually evaluate the performance and monitor the compliance, their compliance with our infection control. So these actually, among with the other KPIs, will provide a feedback for the management, and we will create an evaluation score. Of course, rewards will be there, and for those who fail to meet our expectation, there will be disciplinary action or consequences. So we ask everyone to cooperate with this matter and give their best performance at all times. This is the change. Okay.
Yes.
Next, please, Dr. Khaled.
Next.
Okay. So this in this slide, I just showed a model of the model of change with the points without description. This is the model of change. We have first eight points for total model of change. Next slide, please.
Okay, next.
Okay, so here I have described how we will help the staff to adopt the new change. Of course, according to KOTTERS model, it will be creating the urgency of change. Why is it important? Why this change will help us move in a better
Yes. My question for you, Miss Manar, is how could you make it stick?
How can we make it stick? We can make the change stick by developing the business process, and any amend we see is necessary to support the new change. So if there is any obstacles or anything, we should remove the obstacles. We should actually develop all our business process in congruence with this change, so we can make sure the change will last.
Excellent. Next.
Now we return back to me. So we will talk now about training plan and design according to AADDIE model. Okay, so now first here in this example, we will contact Dr. Mohammad Elsheikh to arrange meeting with him and with his team. In the meeting, we will give him our core value, sorry, not core value, vision, mission of our dental centers, and we will ask him about to put a training programs for our nurses. This is the example for our nurses regarding attitude with patients and infection control.
Excellent.
As we see here, he was very happy in this meeting.
Excellent.
So now,
I am under your order.
Thank you.
It will be my pleasure.
Thank you, Doctor. Thank you very much. So for abbreviation, A is for analysis. Dr. Elsheikh and his team will do the survey and give it to the staff. And they will do also focus group meetings with main directors and officers in the center. From the gathered data, they will analyze our requirements, need, weakness, and the strength in the field that we ask them to improve, which is the nurses. The D for the design, Dr. Elsheikh and his team will design technical proposal for the training program that we will need. We need it, which contain the main outline.
Next.
Okay. After the agreement, after we will discuss with our team and agreement, they will develop for us the training kits and materials, and then implement. Then we need to set again with Dr. Elsheikh team to settle the operational details. Well, that means we need to do where we need to do it, and when, how many hours, and any other operational details.
Excellent.
After that, the evaluation. Evaluation now, we need, after training, to make evaluation, which will happen in a lot of steps, chronologically in steps. At the beginning,
they are very clear. Very clear, very, very good. Excellent.
Here we are using the modified Kirkpatrick model.
Yes.
At the first level, we will evaluate the reaction through the survey. Then later on, after the end of the, by maybe 1 day or 1 week, like in this our case, evaluation through examination and maybe have presentation or oral exam.
Yes, make it not written and oral, make it written for knowledge and practical. Instead of oral, make it practical, okay? Then the visit, very clear. Then the real improvement.
Yeah, Dr. Elsheikh, he need to come to see the center and after a few weeks and check if the training have any impact on our nurses.
Excellent.
Later, we need as a managers and high rank officers, we need to evaluate also the results. If we see a real improvement in the nurse attitude with patients and colleagues, or if there is any also in the infection control. After that, at the end of the year, maybe we need to see if this investment provide a positive return or on our investment, the outcome, the revenue. if there really there is a profit from that or not.
Excellent.
And at the end of this presentation, I want to give big thanks for Dr. Mohammad Elsheikh for his patience and support during the last couple of weeks. He was very positive and energetic, and he gave a lot of pushes for us. Also, many thanks for Mr. Mohammed and the Initiative Management Consultancy for their support. And finally, the big thanks for our strong and creative team. Yani one by one, Mrs. Islam.
Thank you so much. Very excellent project that will deserve full mark. Thank you so much.
Thank you, Doctor. Thank you for your patience.
Thank you. Thank you.
Okay, I will stop the record.
Okay. شكر لحضراتكم جدا يا جماعه، والله يعني على المجهود الرائع، مشروع اكثر من رائع بجد. شكر